Good morning, everybody. It's Petra Irving here. I'm doing a live treatment session this morning, and this lovely patient has allowed me to film our session, but she doesn't want to have her name disclosed or her face, and that's, totally understandable. So she had a tummy tuck 10 days ago. Very straightforward, all done by the lovely Andrew Diver. And so I'm just going to do a very short treatment session just to show what happens when you come for a session of manual lymph drainage. Manual lymph drainage is a very gentle form of massage that supports the functioning of the lymphatic system. So after surgery, you have excess fluid filtration, and that is what causes the buildup of swelling in the tissues. So just to explain about what happens to the lymphatic system, I'm just going to go around the other side. So in normal lymphatic anatomy, there is a midline down the middle and at waist level. You have lymph node groups in the neck, under the arms, in the abdomen and in the groin. And normally above the waistline would drain up, so the lymphatics would drain up to the lymph nodes in the armpit on either side. And in normal before surgery, lymph would drain below the waist down to the lymph nodes in the groin. However, when you've had a tummy tuck, the midline changes. So the new midline would be the scar, and we want to try and reroute the swelling up to the lymph nodes in the armpit. Gravity will pull swelling down towards the scar line, but we don't want the fluid to gather there because that can compromise the wound healing. And very often patients that don't have manual lymph drainage, or if they are having incorrect manual lymph drainage, fluid will pool along the scar line. So a qualified and experienced MLD therapist will be rerouting the fluid up to the lymph nodes in the armpits. So we'll just get started. So I always start off by doing the lymph nodes in the neck and then under the arms. I then get the patient to do deep abdominal breathing, and this just stimulates all the lymphatics in the abdomen. After tummy tuck is quite a traumatic procedure because the skin and the tissues are dissected from the underlying structures so that it can all be moved down. So everything has to re-knit, and that's why it's really important that you are wearing your compression. And the deep breathing is really good in the compression and during the treatment session in having internal, so the breath against the compression will help with the re-knitting of the tissues, but also it is stimulating the lymphatic function. And anybody that is a hardline VODR therapist, I did my training a long time ago, and so my hand movements and routine has been adapted over the years to suit me and suit my patients. So MLD is very gentle. It's just getting a skin stretch. The lymphatics are literally just below the skin surface, and they feed down into deeper lymph vessels and then into trunks, which then go towards the lymph nodes. So MLD should never be deep, aggressive, or uncomfortable. Going to do so just very gentle. When are you seeing Andrew again?
6 weeks.
When do you get the dressings changed?
Well, he's already done it. We took them off actually. We could have them off right now, but
okay.
For the best is leave them on for
yeah. So what I would do, so once the dressings have I recommend once the surgical dressings have been removed using micropore tape, and anybody that follows me on Instagram will know that I'm a massive proponent of micropore because it keeps the skin edges together. So it means that when you're moving, the skin isn't moving, it's supported and stable, and it gives really, really good wound healing. So it would change that and put micropore on. That's brilliant. You use it for 12 weeks. Change every 5 days, because the less you disturb the scar, the better. So
when you're taking it off, does it not pull at the scar?
It's very, very gentle.
Okay.
So it's good.
And it doesn't dry up the micropore tape?
No.
Okay.
Okay. So nice big deep breath in. Inhale, expand your tummy, and exhale, tummy goes in. Nice big deep breath in again. Great. And exhale. So really use your tummy. Inhale. Try and relax here. That's it. And exhale. Inhale, expand your tummy. That's it. And exhale. So I'm doing very little pressure here. It's just a little bit of pressure against the breathing. One more. Great. So MLD is very repetitive and very relaxing. It can have an analgesic effect. So because it's so gentle and it switches off the sympathetic nervous system, so it gives the parasympathetic nervous system a chance to take over. And if you're feeling swollen and uncomfortable, and if you are in any discomfort or pain, mostly after MLD, you will feel more comfortable and in less pain, and it promotes better sleep. That is the scar, so closed over.
Mm-hmm.
That's your parasympathetic nervous system. Very common, rumbly tummies when MLD starts. So I don't know if you can see, but it's just a very gentle skin stretch. My hand doesn't glide over the skin, so it's staying in the one place, but it's just mobilizing the skin. going to do a little bit on her legs because it's very often you get a bit of swelling in the tops of the legs. Did you have your breakfast?
Yeah. That's why it's making that noise, right?
No, it's the rest and digest.
Yeah.
It's when you switch off and everything starts functioning. Okay, I'm going to switch off now because it's not the most exciting of TVs, but it gives you an idea of what happens during a post-op MLD session. It's very, very gentle. It's very relaxing, and yeah. So I've just when I switch off here, I'm just going to change the dressings, and then I'll get the patient to sit up so I can do some massage around her back. So if you've any questions, just send me a DM.